We now proceed to leaders' questions, and the first question falls to Deputy Enda Kenny.
Can I ask the Taoiseach the number of children who may have died in the care of this state in the last 10 years?
Taoiseach.
Well, as the Deputy will know, on the 8th of March last, the Minister for Children and Youth Affairs announced the establishment of an independent review group on child deaths. And that group is composed presently of Ms Nora Gibbons and Mr Geoffrey Shannon. The review group has been asked to examine existing information on all deaths of children in care over the last 10 years and to provide an overall report for publication which includes, on an anonymised basis, key summary information regarding each child and the circumstances leading up to their death. The review will focus in particular on the relevant involvement of state services with the child and his or her family and examine the strengths and weaknesses of such involvement. And the group is also to make recommendations as to how child protection responses can be strengthened. I would make the point that the Deputy will be aware that the question of validation of what numbers have died in care or those who were in, and extending that remit to those who have been in care and were out of care or would require aftercare services, or people who had been where the department had been or the HSE had been notified of the need for child protection. Those are being validated at the moment, so the exact and precise numbers are being worked on and being worked through at the minute. A number of 23 have been confirmed by the HSE as being the figure that they are putting forward at the moment. I think it is important to point out that the government met this morning, and the government is very anxious to ensure that the work of Geoffrey Shannon and Nora Gibbons proceeds as they would envisage it and provide whatever information are required for them to achieve the publication of a report as set out and agreed with the Minister. So we are arranging for that to happen. There has been a meeting between officials at the Department of Health and the Attorney General's Office and the HSE today to clarify the position with regard to any obstacles presenting in terms of the provision of necessary information to the review group. And that has been worked on today as well. So I just want to make the point that from our point of view, whatever requires to be done, first of all in relation to the report itself, what information is required by Mr Shannon and Ms Gibbons will be provided. If the legal obstacles that are there may be to that, we will deal with it by a legislative change if necessary, and I believe that a legislative change will be required, and that will be prepared as a matter of urgency. And the separate issue then in relation to the validation of numbers, that is an exercise that's been undertaken, and the HSE have indicated to the Minister that should be ready by the end of June.
Supplementary, Deputy Kenny.
I'm actually astonished at the response of the Taoiseach. You're the leader of the government, political leader of the country. This information was promised to Deputy Alan Shatter on the 5th of March 2009. You were a former Minister for Health. You supervised the introduction of the Children's First Child Protection Guidelines in 1999. We have a dysfunctional HSE. You have a powerless Minister of State. The Minister for Health beside you, and her predecessor, Minister Martin, and their Ministers of State respectively, were unable to acquire this information about children who may have died in the care of this state. It is truly astonishing that the Taoiseach of the country, himself a former Minister for Health, does not have this information accurately. We have become a health department and a HSE hiding behind process and hiding behind reports. As I said, it's a strange situation that Deputy Shatter, Paul Reynolds or Enda Kennedy's reporters are able to produce more hard evidence than the HSE or the Department of Health, and about children who may have died in the care of our state. It's truly astonishing, Taoiseach, that you don't have that information and that you cannot answer the question. Now, the situation is that a review group has been appointed by Minister Andrews of Ms Gibbons and Mr Shannon, and nobody doubts their integrity. But I understand now that there is a legal problem about giving the information and the documentation on these children who may have died to the review group. Now, can I ask you, arising from this debacle, which is one of the most monumental failures of the state, with a HSE that refused to give information accurately in the beginning about x-rays in Tala, about breast cancer situations down in Portlaoise, about information insofar as charging elderly people going into nursing homes was concerned, that you have a dysfunctional HSE, and the Minister for Children, as Minister, appears to be but a decoration at the Cabinet table. Now, I'd like to know, Taoiseach, when are we going to get the information accurately from you? Will you introduce the necessary legislation, if that is necessary, to overcome the obstacles that are being created by the HSE? Are you prepared to accept responsibility for this situation, and see that it's sorted out, because Minister Andrews has patently failed to do so? This is about a life and death situation where we're reported now that up to 200 children may have died. This information was to be given to Deputy Shatter arising from a Dáil debate on the 5th of March 2009. I find it incredible that on a matter as sensitive and as important and as subjective as this, that the head of state does not have this information accurately after all this time and all these years.
And Taoiseach.
I've explained to Deputy Kenny on the 10th of March last, the Minister, having set up this review group on the 8th of March, he wrote to the Chairman of the HSE asking for a validated list of all deaths of children in the last 10 years, which would be given to the review group for their consideration. So the Minister sought that within 2 days of setting up the group. No, I'm sorry, Deputy Mitchell, he set up the review group on the 8th of March 2010. The Minister immediately asked for a validated list to be forwarded to the group so that it could be dealt, so that it could deal with the matters as he outlined. And they have advised the Minister, the HSE, that it will take until the end of June to complete an accurate and consistent list of deaths of children in care in that respect. Now, that is the information that's available to the Minister, and that work is ongoing. I agree I would rather have that information to hand immediately, and obviously the collation of that information or the recording of that information is not what one would expect it to be, but that is the situation. In relation to a separate matter of ensuring that whatever information is required by Mr Shannon and Ms Gibbons be provided, the Government this morning were of the view, and are of the view, and it's been confirmed in the discussion that's taken place this afternoon between the Department of Health officials, the Attorney General's Office and the HSE, that in addition to the HSE providing factual information requested by the review group to be furnished by the HSE as a matter of urgency and no later than Friday of this week in respect of previously identified deaths of children in care known to the HSE, that there should also be, to allow the exchange of information between the HSE and the Department, the sharing of which might otherwise be legally restricted, a legislative amendment is required. And we will bring forward that legislative amendment as a matter of urgency. The privacy of children in care, in state care, will continue to be protected in any proposed amendment. But I want to make it clear that obviously the review group have been notified of these arrangements. As you say, Deputy, they are respected persons in this area, and we are proceeding along those lines and on that basis ensuring that the work gets done.